Hello, this is Rashi Sahai and you're watching Medicircle. Today on our World Heart Awareness series, we have Dr. Amol Dharmadhikari with us. Dr. Amol Dharmadhikari is a consultant cardiothoracic surgeon in Kolhapur and is currently practicing in Aster Aadhar Hospital, Kolhapur. For the past 23 years, he has worked in this field. Welcome to Medicircle, Dr. Amol Dharmadhikari.
Thank you.
So, heart disease in India accounts for nearly 60% of the global impact of cardiac health, even though India accounts for less than 20% of the global population. So, doctor, can you tell us what exactly is heart disease?
Heart disease is actually a broad terminology. And we can say there are two main parts into it. One is an acquired heart disease, and one is a congenital heart disease. Now, what do you mean by congenital? Is by birth. If someone has a heart disease by birth, that means there is having some different connections in the heart or a hole in the heart, then that is a congenital heart disease. And acquired heart diseases are like you say a person getting a heart attack, or there are blockages in the arteries of the heart, or we have 4 valves in the heart. If those valves get damaged, then that also can be considered heart disease, which is acquired heart disease. So these are the things which can occur with the heart or with the covering of the heart. So broadly, as I said, one is congenital, one is acquired.
So doctor, what are the symptoms of heart disease?
Symptoms of acquired heart disease, if we want to know, that would be like typically they may have some chest pain, which may be on the left side of the heart, or it might be on the right side of the chest also. People may have some shoulder pain also, and some people may have throat pain, which might be occasionally which comes. Then in the back pain also might be there. So any pain which might be there from your jaw up to maybe say the umbilicus, that may be related to heart disease. Patients may have breathlessness, difficulty in breathing. So like if you're used to do some certain amount of activity daily and you suddenly feel like now doing the same amount of activity, you are having breathlessness or not able to breathe properly, that is a sign of heart disease. Or swelling of the lower limbs. There is some edema or swelling of the lower limbs, that can be a sign of heart disease. Then even cough can be a sign of heart disease. So these are various signs of heart disease which the patients might find.
So doctor, can you tell us about some causes of heart diseases?
Heart disease, if you concentrate upon coronary heart disease or ischemic heart disease. Now, this is caused by blockages in the coronary arteries. Coronary arteries are those arteries which supply the heart itself. Okay, so if these arteries have some blockages, now blockages are created by what you say as atherosclerotic plaques. These are lipid or cholesterol plaques which develop inside the blood vessel, and then these start to hamper the proper blood flow to the heart, and these may be the cause of heart disease, especially when I say ischemic heart disease. Other is valvular heart disease. The heart has 4 valves, so these valves in the hearts, they can be damaged by 2 things. One is by infection, now which we call as commonly in India it is rheumatic valvular heart disease. This is the common infection in the childhood, which later on, as the person grows, maybe in his 30s or 40s, the infection spreads to his heart valves, and then the valves can get damaged. Other is as the person grows older, like maybe 60s or 70s and on, some calcium deposition also occurs on the valves of the heart, and that can reduce the movement of these valves, and then the patient can have this heart disease of the valve.
So, can you tell our audience about the types of heart diseases?
As I said, heart disease can be broadly divided into congenital and acquired. Congenital, the baby might have a hole in the heart, which may be termed as a simple heart disease, simple congenital. Complex congenital means the heart during its development has the connections got wrong. So the big arteries which are coming from the heart, one goes to the body, one goes to the lung. If these are interchanged, then that can be called as complex congenital heart disease. In acquired, as I said, ischemic heart disease, which occurs due to blockages in the coronary arteries. And second one is valvular heart disease, which affects the valves of the heart. And that is the reason the valves may get either narrowed down or they may leak. So, see, valve is like a door in the heart, which allows the blood to flow in one direction only. So, if the flow in that direction is hampered or slowed down, that is called as valvular stenosis. If the valve allows blood flow in the reverse direction, that is called as valvular regurgitation. So, that is again a form of heart disease. Then other heart diseases, like we can say, if the bigger blood vessels from the heart, if they get dilated, like aneurysm, and that also can be considered as a heart disease. That also needs some surgical treatment.
So, what is the relation between cholesterol and heart disease?
The cholesterol, as we all know, that is very much required for our body cells to function properly. And each and every cell of our body has cholesterol in it. Most of the cholesterol which is in the body is produced inside the body. Now, there are two types of cholesterol, which may say one is HDL and one is LDL, broadly speaking, HDL and LDL. Now, the HDL is one which is good, and LDL is one which is not good for the heart or the blood vessels. Now, this cholesterol, the bad cholesterol, what happens is that if it starts getting deposited inside the blood vessel, then that may occur because the blood vessel internal lining gets damaged, maybe due to hypertension or maybe due to other causes like diabetes or trauma or infection, inflammation. Now, this gets deposited inside the blood vessel, and as the deposition starts increasing, the forward flow of blood in this blood vessel gets hampered, and that is the reason the patient might have a heart attack. What does good cholesterol do? Now, good cholesterol removes all the bad cholesterols or the lipids and takes it down to the liver so that it can be metabolized there. So this is what cholesterol and heart disease has a relation.
So, can you tell us about some ways to prevent heart disease?
Ways to prevent heart disease, or we can think of only acquired. So there are causes of heart disease can be broadly divided into modifiable causes and non-modifiable causes. Non-modifiable causes are age. As the age grows, we cannot change it. Then gender of a person. The male gender is more prone for heart disease than the female gender. This cannot be changed. These are non-modifiable. Then gene, hereditary, gene structure of a person. Till date, now we are unable to change the gene structure of a person. As you said, Indians as such are more prone for heart disease genetically. So that cannot be changed. Modifiable factors like we can change our diet. One, the diet which is unhealthy diet, as we say, junk food, fast food. Then we think about oily food. Then especially processed food, processed carbohydrates, then processed fat, all these things which are more processed, those foods should be avoided. Then if the person is smoking, that smoking should be stopped. Alcohol intake should be in moderation. It should not be heavy alcoholic. Then regular exercise. Now, what is recommendation is at least 30 minutes for a minimum 5 days a week of regular moderate exercise, not heavy exercise. Moderate exercise is what is advisable. That is what, these are the things which will help you prevent getting a heart disease. So diet, lifestyle, and regular checkup, especially after the age of 40-45, that is going to prevent from getting a heart disease.
So, Doctor, on Medicircle, our main focus have always been to provide the audience with a large amount of information in less time. And so today we will be conducting a small question answer session in which you could either answer in yes or no or in 1 or 2 line sentences. So, Doctor, my first question is that can diabetes cause heart disease?
Yes, diabetes is one of the major causes of heart disease.
Can stopping smoking lower the risk of heart disease in an individual?
Stopping of smoking usually starts to show its benefits by the end of 2 years. So if a person has stopped smoking for 2 years and all, then the benefits can be definitely seen.
And can a person lower the risk of heart disease with vitamins and supplements?
Vitamins and supplements, I would suggest instead of going for the commercially available tablets or the supplements, I would suggest go for fresh fruits and healthy diet, as they contain good amount of vitamins and supplements. Those are better than going for commercially available supplements.
Okay, Doctor, thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you very much. It was really a pleasure working. Thank you.
Thank you.